Hello everyone, today's video is about low-dose naltrexone, also known as LDN. Just before jumping into the video, if you don't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. And also, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So somebody had posted a comment on one of my other videos the other day saying something like, what are your thoughts about low-dose naltrexone, or what's your experience with it? And I said something like, I've posted about that before. Can you please, check the, past videos on usually easiest to keyword search on my YouTube channel. And so she messaged me back saying, I've searched and I can't seem to find the video. So then I just searched and I couldn't find the video either. So apparently I have not done a dedicated video about LDN, and I've certainly talked about it in some other videos, but I thought, by golly, I've got to do a dedicated video about LDN. So thank you to the individual who asked about the video, and thank you for bringing it to my attention that I did not have a video on LDN. So low-dose naltrexone, which I do want to just clarify, because I do talk a lot about low-dose immunotherapy or low-dose allergen therapy, which is LDI or LDA respectively. Some folks get that confused with LDN. Usually it's the other way around. I'll say something like, have you heard about low-dose immunotherapy? And they'll say, yeah, I heard about that. It's like, the opiate receptor thing. I'm like, no, that's LDN, and all these acronyms can blur together. So low-dose naltrexone, just for folks who are not familiar, is a treatment where folks take a low dose, as the name suggests, of this drug called naltrexone, and there are certain health benefits that can be associated with that, which we'll get into in a minute. Why the heck would a person, take naltrexone, or what is naltrexone? So naltrexone is an opiate receptor antagonist, so basically blocks opiate receptors. And so when folks, the drug was originally developed to help people actually get off opiate drugs, to help, kind of kick the addiction, so to speak. So basically, naltrexone was developed to do what nowadays methadone, is typically used for that purpose, or other drugs as well. I'm not a specialist in opiate weaning, but anyways, that's maybe there's other drugs out there, but anyways, methadone would be a sort of analogous example. But naltrexone very quickly fell out of favor because the side effects were just absolutely awful. I can't remember the exact side effect list, but I think just horrendous, nausea, vomiting, just feeling just really, really rotten. So the compliance rate was terrible because it was just fraught with all these side effects. And generally, to my understanding, when clinicians would prescribe naltrexone at normal dose, not low-dose naltrexone, just regular naltrexone, it was around the 50 milligram dosage range. Most folks, when they're using low-dose naltrexone, back in the day, when I first started hearing about this, maybe, 7 or 8 years ago or so, the standard kind of max dose around that time was usually around 3 milligrams. Then it kind of crept up over time to more like 4.5 milligrams. Some clinicians nowadays, I believe, are using 5 to 6 milligrams in some cases, but generally 4.5, 3 to 4.5 milligrams seems to be kind of the max dose to still call it low dose naltrexone. And thankfully, at that really low dosage, the LDN does not give those horrendous side effects that folks would get when they're taking full dose naltrexone for kicking opiate addictions. So why the heck would a person want to take this opiate receptor antagonist? The long and short of it is that LDN, when it binds to these opiate receptors, it ultimately induces a number of different effects. For some people, it has a calming effect. Other people, it has an immunomodulating effect. For some people, it has a prokinetic effect in their gut. So if they're having constipation or issues related to small intestine bacterial overgrowth, then sometimes LDN is used as a prokinetic to move things along, kind of like the drug prucalopride, also known as Resitran, which is kind of a shining star of the prokinetic pharmaceutical world anyways. And then LDN also has some anti-cancer cell benefits as well. So it's a really kind of broad spectrum therapeutic, and can be really, really helpful for some folks suffering from complex chronic illness. Has a role to play in some folks with autoimmune disease as well, and due to its immunomodulating effect. So folks who are diagnosed with mold illness or chronic Lyme or / persistent borreliosis or other chronic infections, folks with mast cell activation syndrome. there are clinicians out there who will prescribe LDN for any and all of those conditions, or more like kind of shall we say less specific labels like fibromyalgia, chronic fatigue syndrome. Like some folks with those diagnoses will receive LDN as a therapeutic trial as well, or therapeutic intervention as well. Of course, many folks with fibromyalgia or chronic fatigue syndrome have underlying issues with, say, mold toxicity or chronic infections or what have you. But anyways, let us spill over there. So LDN, quite broadly applicable in the complex chronic illness world. So that's the little background. So circling around to this individual's question of what's my experience with it, or what are my thoughts about it? So with LDN, one of the things I really like about it is that it's generally well tolerated. As mentioned, it doesn't cause the horrendous side effects of full dose naltrexone. Folks are generally advised, or virtually always advised, to gradually build up the dose, because it can cause nightmares or vivid dreams or sleep interruptions for some folks. That tends to be a side effect that will come up with building up the naltrexone too quickly. Most patients, with rare exceptions, seem to be able to build up to that therapeutic dose of, say 3 to 4.5 milligrams. But some folks really struggle with it and can't tolerate it. Some people take it and they herx from it and whatnot, but as a rule, it generally is quite well tolerated. So I really like that about it. And some patients, in my experience, they really benefit from low-dose naltrexone. I've had some patients where they've said, this is like the first thing that's made any difference with my chronic pain, whether it's joint pain, muscle pain, neuropathy, whatever it happens to be. So for some patients, it's been really effective for chronic pain. For other folks, they found that it's really helped with their anxiety, really helped to kind of settle down their nervous system. For some folks, not too often, but every once in a while, folks who have inflammatory symptoms related to some autoimmune condition, whether it's a person having an issue with, say, a neurogenic bladder, and they have an MS diagnosis, like, oh, the LDN, helped with that, or a person with rheumatoid arthritis, oh, it's really helping my joints. So sometimes I've seen patients that have benefited when there's an autoimmune condition underpinning what's going on with them. So pain reduction, anxiety slash stress reduction. Those are the main benefits that I've seen in practice. Every once in a blue moon, a patient will say, oh, like my energy's so much better, or my my headaches are doing better, or my brain fog is doing better. But I find it's more the exception, that like kind of the more rare exception than the rule, that those are symptoms that improve. Now, don't get me wrong. I mean, some folks, when their pain is getting better from an intervention like LDN, then over time their energy levels start to improve, because the chronic pain isn't wearing down their energy levels like crazy all the time. So like there could be sort of that kind of spillover, but in terms of a direct impact on pain levels, I haven't really seen a lot of that in practice. Just for context, like, have I seen 5 patients on LDN? Have I seen 5 million patients on LDN? What is my data pool here that I'm drawing these statements from? So I estimate that I've seen probably around like maybe 300 to 400 patients who have been working with low-dose naltrexone over my practice career. Unfortunately, where I practice in beautiful Nova Scotia in Canada, we don't have, as a naturopathic doctor, we don't have prescribing authority out here, so I'm not able to prescribe LDN directly. Much to my chagrin, I'd like to be able to offer that directly to patients, because it can be a really useful tool. It can be definitely a worthwhile thing to try. But by proxy, there are some local medical doctors here, and of course I have patients all over the place, in the States and in other Canadian provinces and in some international locations, where one way or another, many of my patients have been able to access low-dose naltrexone through other clinicians. So by proxy, I've seen how they've done, what the dosing looks like, all of that. Plus I've done lots of continuing education courses where clinicians are talking about prescribing it and how to prescribe it and all of that stuff. So I'm quite familiar with it, even though I can't actually write that prescription to have someone get LDN. So I do have quite a few. I do have quite a bit of experience in terms of tracking folks who are working with low-dose naltrexone, and so that's what I've seen. So when a patient comes in saying, I'm going to try LDN, I'm thinking to myself, great. I think it's worth trying that, especially if there's pain or sort of like stress, anxiety as a notable part of their health concerns. I certainly don't go into it thinking like, oh my gosh, this is going to be the best thing since sliced bread. I go into any treatment, whether I'm prescribing it or somebody else, with optimism. As long as I think it's safe and not going to have any major issue for them, go into it with optimism. But generally, it can be a helpful therapy. I have not seen it be a panacea, unfortunately, but it's certainly been helpful for some folks. So I hope that this information was useful. If anybody has any questions or comments about LDN, it really helped you, it didn't do much for you, something in between, please feel free to post in the comment section below. And any questions about anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.